Hey all, Cohen here. Haven't posted a video in a while, wanted to post one. Been super busy with Pride and with Christmas, and my son's birthday is right before Christmas, and also my own healthcare issues. Just to catch up, I have a bladder stone. It's probably the size of a Timbit, like that, I guess. I've seen pictures of it, I have seen a scan of it, and I am still waiting for my date. I have a date to see a urologist on January 3rd, but this has been going on for a year, so it just really sucks. And the longer it goes, I'm only assuming the bigger that it's getting because it hurts a lot more. If you follow me on Instagram, you know that like I can't sit, stand, do like I can't really do anything without being in pain. I did get pain medication finally from my GP, so that's good. But there is no like, oh, well, we'll contact the urologist and see if we can get you in earlier because of how much pain you're in. Because when somebody says they're pretty much in an 8 to 9 out of 10 pain, you usually take that pretty seriously, but I don't feel like it's being taken serious. So that sucks. So right now I'm dealing with the bladder stone that I've had for about a year. And obviously it's gotten worse over this past year. That has nothing to do with my phalloplasty, so that's a little bit bothersome as well, that everything was just left to be kind of like labeled as like phalloplasty, so like we won't look into it thoroughly because we just assume it is something to do with that. So that really sucked. And then now I had my phone call with Dr. Crane today, and obviously like I'm not blaming anybody. It's not Dr. Crane's fault. It's not Dr. Schaefer's fault, because apparently my body heals itself so well, even with having to go to wound care for like underneath my phallus, because the first time that I got a graft done was my second surgery, my second stage, and that one kind of like healed itself. So there was only a little bit of graft that was like there that was laid for urethra. So then when I went this past time, which was back in October, they did another one so that it would be wide enough so that they would be able to create my urethra. Well, I heal so well that apparently that has healed almost, like it didn't completely heal closed, but it's still not big enough for them to make my urethra. So my next stage that was supposed to be finishing off my urethra and giving me testicles is actually going to be me going back to Austin, and they're going to take tissue from inside my mouth so that something mucosa, I can't remember right now. I'm so like just beyond out of my own head. I'm so just like I don't even have words for how I feel. I don't have words for anything. All I know is that for the past year, I have not been able to live my life normally. And generally, in between surgeries of phalloplasty, after a month or two, you can usually start getting back to your everyday life. And that has not been how it's been for me since shortly after stage 1. In August, it would have been a year, I think, since my first phalloplasty surgery. I've technically had 4 because my first stage I had a surgery and then I had to go back in to get something fixed the day before I left to go home because some stitches came out, so then I had to go under again. And then I went for my second, and then I went for third most recently, and now I'm gonna have to go back for a fourth, and all that they can do during that stage is take the tissue from inside my mouth and lay it as a graft and hope that that one doesn't heal into itself. Otherwise, I don't know what they're gonna do. I'm not sure. I'm not thinking about that because I don't want to think about it at this point in time. I'm just so frustrated with the bladder stone, and I'm frustrated with like money, life, whatever it may be. It's just a matter of like these physical things are making things a lot more difficult for me, and I just wanted to update everybody because usually people go into phalloplasty and within stage 1 or 2, you have your urethra and you're ready to go. Well, that's not how it is for everybody, clearly. I don't know why this is happening. Again, the surgeon said that my body heals very well, which I do notice that. And to be honest, from what the like couple days before I started going to wound care, the way it looked about a month and a half ago to now is like night and day. Like you wouldn't have even known that I had to go get wound care done, to be honest. Like it's just like it's pretty much healed, and that's like within a month and a half that like a pretty big area that was having trouble like healing on its own, it's pretty much healed. So picture like maybe like a 5.5-inch length to like this wide of area that was all like having trouble healing. I guess, due to an infection, but then after the infection was gone, it started healing rapidly, and with the wound care, even more so. So I have to go back and get the exact same procedure done for the third time, but using a different area for tissue in hopes. Please cross your fingers for me. It's not until April, but like I literally will have to get my bladder stone taken out surgically. I will have to go back and get my urethra stuff done surgically, and then after that I will have to go back and get my urethra finished and my testicles done. So like within the span of about a year, I've already had 4 surgeries, and people might say, well, take a break because maybe that's why it's stressing you. No, 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 no. Okay? I have my own mental health issues. I've been able to deal with them for the majority of my life on my own because I do not get the proper care. I know for a fact my brain is only becoming more fogged because my body and the physical things that I need done are not being done. Like my bladder stone should be taken care of. That's an urgency thing. Like that's not something you just let me wait. But okay, let me wait because that's what's happening. And then you have the phalloplasty part, which is like, it's not the surgeon's fault if it does that, and it's not my fault because it's just like my body just healed it. So yeah, that's where I am right now. That's literally within the last 24 hours, like the information that I've been given about my bladder stone, about that. So like pretty much at this point in time, I'm waiting for January 3rd to go get my referral appointment with the urologist, and then I'm praying and hoping that they put me in ASAP to get this thing taken out, because I did mention that if this bladder stone, if it in any way screws up anything to do with the work I've had done for phalloplasty, I will not be happy. The response on the other end of the phone seemed to not give 2 shits, but that's how I feel, and that's how I will be if that does happen, especially mentioning it as much, calling the doctor, having to email my doctor, which I was not allowed to do. But at the end of the day, it's a matter of if I can't get a hold of your office and I can't get a hold of you and I can't trust to go to the ER because I'm trans and I don't trust somebody to not screw up what I've already had done, I'm going to send an email because somebody needs to do something. And at the end of the day, my surgeon from San Francisco that I saw in San Francisco that no longer even works with the Crane Clinic, and Dr. Crane both keep in touch with me, and their offices get back to me lickety split, and I can leave a message. So at the end of the day, it's really sad and pathetic that the majority of the help that I am getting are from surgeons who are in another country, and one of which is no longer my surgeon and doesn't even work for that surgeon's office anymore because they moved back to LA and are doing their own thing for the next little while. So, yeah. Make sure that you are advocating for yourself, because even when you advocate for yourself, it doesn't always work. So just keep pushing. And like, honestly, there are a lot of people who are in the same boat as me, not necessarily the same issues per se, but having to like push and push and push, and then realize that like certain people care more, but they're the people who can't help you because they're not there for you. They're in a different country. So like, happy holidays!